2020 regular but remote meeting of the Burlington Board of Health to order. It's been about 7 months now that we've been meeting remotely, and we look forward to a face-to-face meeting in the future. But things are what they are. Right now, Board of Health member Libby Wallenjevich will represent everyone in reciting the Pledge of Allegiance.
Thank you, Mr. Chairman. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you very much. I'm going to ask for a motion to take the school reopening updates because we have with us this evening Mr. Patrick Larkin, who is the Assistant Superintendent on our line, that we can speak with him. He has a school committee meeting at this same time, and we want to get him back to that. So could I please have a motion?
So moved.
Second.
I have a motion by Dr. Sullivan, second by David McSweeney. All in favor? David McSweeney.
Aye.
Wayne Saltzman.
Aye.
Libby Wallenjevich.
Aye.
Mary Beth Welch.
Aye.
And I vote aye, 5-0. I'd like to now open this up for a quick report from our Assistant Superintendent, and then we can ask him any questions that we may have. So please, Mr. Larkin, give us a little summary or an update of what's going on in the schools right now.
Sure, Dr. Weiner. Thank you for the time tonight. And I first want to start by thanking Chris Pollock and Susan Luminello for their collaborative efforts to help us get our policies and procedures in place and get school reopened in Burlington. I'm not sure if everybody's aware of it, but there's not too many districts around locally or around the state that have gotten schools back in person as early as we did. And a lot of that was due to the effort of the folks from the Board of Health that helped us look through our procedures and our policies. So we really are grateful to you for the support. And I know we've talked more in the last couple of weeks than I've talked in my whole 12 years in Burlington, but that's a good thing. I really appreciate getting to know your folks better, and the level of support they're providing is a great comfort to us. With that, credit certainly, I want to mention our nurses too. Our nursing department is really been the front lines of, when kids aren't feeling well and making sure we're going through our checklist and talking to families and supporting them. So want to just give them a mention as well as the teachers. We all came back, a little over, we're coming up on, I think, 2 weeks now, this Thursday when we first got people back in school. Our elementary students will have been back a couple weeks as of Thursday. Last week was our first full 5-day week. And, school's a little different, but it's really comforting to get back into a routine with kids, and you can see the looks on their faces and the interaction, and feedback from families has been very positive just to get kids back into school. So I don't really have any huge informational updates, although, school looks different, but we're getting great support from students as far as following the procedures, wearing their face masks, washing their hands. The custodial staff has been great about keeping on top of cleaning in a much different fashion than they've ever done before. So I'm really going to just throw it to you for any questions. Possibly answer for you.
Does anybody on the board have any questions for Mr. Larkin?
Mr. Chairman, if I could.
Please.
Yeah, so thank you. And Mr. Larkin, thanks for attending, and thanks for your continued efforts around getting our students and staff, school staff, back safely to school. I appreciate it. I know, as I said, before school's open, this is a monumental effort, and you don't know what we don't know. So I appreciate everybody hunkering down and making sure that the safety's there. I guess my only question would be, and maybe this is actually for both you and for Susan maybe, is We talked a lot about that no plan that we develop is necessarily going to be 100% effective because like I said, we don't know what we don't know. And also, we have to enact it in real time, real life situations, which we can't always plan for everything. What kind of changes or hurdles, and maybe I shouldn't use the word hurdles because that implies something larger, but what kind of changes to the plan and or concerns that we've addressed along the way, or calls that you're getting from parents, and again the same question to Susan, that we had to address real time and or make some changes to the plan?
I don't mind. Like, one of the concerns we've gotten so far from parents is we have a very strict checklist for staff and for families. If there's any symptoms on the checklist, then they should keep their student out of school and be tested before they come back. So that's been upset some families, but again, trying to be from a cautious standpoint in this environment we're operating in. So again, we may look at that a little more deeply. One of the Board of Health support. One concern from families was, this could be a cost problem. Where do I get testing? And the Board of Health has been great about, making sure that we know the places folks can go for free testing, and they don't need an appointment ahead of time. So just that type of information is things that we didn't have at our fingertips because we weren't faced with those individual situations. So just again, that's the one kind of concern I'm getting. I don't know if Susan has anything to add. Is in regards to, like, people feel like we're being a little bit restrictive in sending kids home for things that they typically would have just laid down in the nurse's office and gone back to class potentially.
Do any other board members have any? Oh, well, Susan, have you anything to add first, please, first?
Um, no, I think things have gone pretty smoothly. I think there's some things that we still have to work out. We're still trying to figure out the communication between us and the schools, and what's the best way to do that, and how we can get information out as accurately and as quickly as possible. So we're continuing to work on that, trying to tweak the communication planning. And we had discussions a couple of weeks ago, Christine Mathis and I, with Patrick and Bob, about the cleaning procedures and the cleaning solutions that they're using, and gave them some recommendations on that. Um, and I think we had some issues, as some people have called about the busing, concerned about the busing, but I think the schools are working through that, trying to figure out, and maybe Patrick can provide an update on that, on where they are in just ensuring that they know where children are located on the bus and that they're staying in their seats. And Patrick, you want to give an update on that?
Yeah, thanks, Susan. That is obviously we were later than ever getting the bus list together, just because one of the things we had to deal with for the first time ever is deny some students busing in Burlington. So that's something that's never happened before. So um, once we saw the need, how many students were requesting buses, from that standpoint, we had to start to go out. You can go out to 2 miles from a school and not provide transportation. We're not anywhere near that in Burlington. But based on the need, we had to tell some folks that they would have to drive to school or walk to school, and usually they're close enough to walk. But with that in mind, at that point, we started to build the lists, and we're still chasing the bus company for a seating chart on those buses. What we do have access to right now, which it would take a little bit more time than a seating chart, but it wouldn't take us days, it would take hours, to look at a videotape of where students were sitting if we ever had to do contact tracing from a bus. But again, we are really pushing for those seating charts to be finalized. And we've reiterated the same thing, Susan, about making sure students sit in their assigned seats, that they're using the social distancing. The bus has placed dots on the seats in the bus where students should sit. And there have been instances where I've had to call on a particular bus and say, these students were not spread out enough. So we're on top of that, and we appreciate feedback from the community if they're seeing something that they think puts kids at risk.
Thank you.
Thank you very much. Thank you, Mr. Chairman.
Is there anybody else have any questions?
Hi,
Just-
Ed.
Yes.
Hi.
Mary Beth.
Hi.
Welch, please.
Hi, Mr. Larkins. I'm speaking more from a parent of a freshman, and thank you both for collaborating with the Board of Health as well. As a parent, it's been no stress in our house. And again, as David said, what we don't know, but it's been very smooth. And I know my son's excited. He's chose the hybrid plan, and we've chose to drive and drop off and pick up. So
That's great.
So
I'm glad
far,
it's going
yeah.
well so far. Yeah.
yeah, it's different as a freshman for the first one going as
Yeah.
a freshman, but hey, it is. It's been smooth. So
I have a daughter who's a freshman in another district, and she's full remote to start. So it's kind of sad to start your high school career that way.
yeah, I think it's. I have been hearing positive things, and I guess the one that you spoke of, Susan, at the bus, and sounds as you said, we're addressing it. We're addressing it in real time.
Yeah, I would just again encourage people to reach out to myself, the administration at a school or the Board of Health. I don't really care who, but just reach out if you have something you're concerned about, and don't I would encourage people not to share secondhand stories. Please reach
Exactly.
out and get firsthand answers, because again, most of the people I'm hearing positive things from, but it's not perfect, and we're going to get better at it.
Yep, and that's great advice, and that's what I always do, especially as a board member, is to push those back to our director. So
Thank you. Yeah.
now we're collaborating with the school committee. I'll do both. Thanks so much.
Thank you.
That's it, Ed. Thank you.
Well, just one comment. I speak to the chairman of the school committee every day, usually 7 days a week, sometimes twice a day. And she has given me glowing reports of your work, Mr. Larkin, the work of the superintendent and your staff. And this town should be proud of your hard work and commitment. And I personally want to thank you. We talk about the things you do every day, and I know that they're huge. So thank you on behalf of the Board of Health and the
Thank
town
you.
of Burlington.
Thank you. And again, we couldn't do it without the support of your folks, especially Susan. It's really comforting to have her a phone call away. So thank you.
Thank you. Well, thank you very much, Mr. Larkin. I don't think, is there any other, if you just, I don't see, is there any other people on the line, Sarah, who have questions? No, she says no. Mr. Larkin, thank you so much. We may ask you again next month, too.
Be
In
happy
fact,
to
we
come
will
back.
ask you again next month.
Be happy to be here. Thank you.
Thank you very much.
All right.
I'm going to take a step back now. I'm Ed Weiner. I'm chairman and of the Board of Health, and with us today are board members, David McSweeney, who is vice chair, Wayne Saltzman, member, Libby Wallen-Jevis, member, and Mary Beth Welch. Also with us is Susan Luminello, Director of Public Health, Christine Mathis, our environmental engineer, Dawn Cathcart, our recording secretary, our recording clerk, and Sarah Kodamash, who is the Board of Health Administrator and IT host. I just promoted you, I guess. Last, I want to thank BCAT, and tonight we have Chris Flaherty for their hard work in making sure that the Board of Health is available to the town of Burlington in this state of a declared state of emergency. Mr. McSweeney, who is the Vice Chair of the Board of Health, will provide the legal requirements for this evening.
Thank you, Mr. Chairman. Pursuant to Governor Baker's March 12th, 2020 order suspending certain provisions of the open meeting laws, general law, Chapter 30A, Section 20, and the Governor's March 15th, 2020 order imposing strict limitations on the number of people that may gather in one place, this meeting of the Burlington Board of Health is being conducted via remote participation. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings as provided for in this order. A reminder that persons who would like to listen to or view this meeting while in progress may do so by tuning into BCAT Government Cable Access Channel, the BCAT Government Meeting Facebook live feed, or over the phone at 408-418-9388, meeting number 173-004-3404. That's phone number 408-418-9388, meeting number 173-004-3404. Also, we will be monitoring the comments on Facebook Live to see if there's any that we wish to address. And as a reminder to the board that all votes are required to be done by roll call for virtual meetings. And with that, it's back to the chair.
Thank you, Mr. McSweeney. Again, please note we're live on BCAT and available for comments and questions through this video technology. Everyone, as I've said before, remote meetings and chairing remote meetings are not easy. Preparation is many times that of an in-person meeting, and please understand, we're looking at monitors. We cannot see sometimes who is speaking, and there's no availability for nonverbal communication. The board and I are doing the best we can. At this point now, we have approval of minutes, first of July the 28th.
So moved.
I have a motion by Dr. Saltzman. Do I have a second?
Second.
I have a second by Mr. McSweeney. Are there any other comments, corrections, changes? If not, I'll put it to a vote. Mr. McSweeney,
Aye.
Dr. Saltzman,
Aye.
Libby Wallenjevich,
Aye.
and Mary Beth.
Aye.
No. Thank you so much. The next we have is minutes for August the 25th.
I'll make a motion to approve the minutes of August 25th.
Second.
I have a motion by David McSweeney. Who seconded it, please?
Libby.
Libby Wallenjevich, second. Any changes, omissions, errors? If not, I'll put it to a vote. David McSweeney,
Aye.
Dr. Saltzman,
Aye.
Libby Wallenjevich,
Aye.
Ms. Welch,
Aye.
and I vote aye. So 2 5 zeros. The next, we have minutes from September the 8th. Do I have a motion to approve?
So moved. Second.
I guess it was Dr. Saltzman, second by Libby Wallenjevich. Are there any corrections, omissions? If not, I'll put it to a vote. Mr. McSweeney,
Aye.
Dr. Saltzman,
Aye.
Ms. Wallenjevich,
Aye.
and Ms. Welch.
Abstain.
And I vote aye, 401. Thank you very much. Next is citizens' time. Do we have anybody on the line who would like to speak to the board? I'll ask our IT expert, Sarah Kodamach. Is there anybody on the line? I am seeing she's nodding no, or she's saying no.
I don't see anyone at this time.
Thank you very much, Sarah.
Mr. Chair.
Yes,
Mr. Chair, I'd like to take this in lieu of citizen time. I'd like to take this opportunity to make a motion to introduce new business into the minutes.
we will do that. We will do that. I think we can just go ahead and do that under discussion if you would like.
Or do
We
you
can
want?
bring up new business at that time.
I thought it best to introduce it at the beginning of the meeting rather than the middle or the end.
Okay, so let's first get through the chairman's and the subcommittee reports, and then we'll go right into that. Would that be all right with you?
Sure.
Thank you. Chairman's report. Well, these times continue to be, all I can say is extraordinary, but we're getting there. If you noticed, we are gray on the state COVID map. And last week, we were less than 5 cases of COVID in Burlington. And I'm going to say in part due to this Board of Health and this Board of Health staff. We continue to face many never-be-seen challenges, but the board is meeting all of these challenges head-on using innovative plans that we developed well before this pandemic. Over the last 2 weeks, since I addressed the board, we've done a lot. This board has done a lot to keep this town safe, as well as performed all of the duties of a public health organization. And I'm just going to go through them again. Town development, including drainage, sewage, site plans, subdivisions, environmental issues, and inspections. We had household hazardous waste day, biotechnology permitting, communicable disease review and actions. I can't say enough about our Burlington Volunteer Reserve Corps. Not only have they assisted us in many ways, they continue to drill. I have daily discussions with the school committee, school leadership. I remotely meet with our town administrator regularly. Our staff responds to scores of complaints involving the pandemic and continue to take many questions from our town citizens. And yes, the Board of Health has and continues to be very busy and in the forefront. I represented our board in a very successful Household Hazardous Waste Day last Saturday. Dr. Saltzman and I attended our first subcommittee meeting with the school committee. I pursued the issue on a state teleconference of commuting individuals from Florida, and we can talk about that a little bit later. And we will be meeting with the town clerk, Amy Warfield, to review the next town meeting in a process that will keep all of the town meeting members safe within the high school. I want to thank everyone who's done so much for the community. Now, we have a small agenda tonight, but as we have done in the past, we still want to provide public updates to the community, and hopefully we will answer any questions. So thank you very much. My report, and I want to now go to subcommittee reports. And Dr. Saltzman and I did attend the subcommittee. Would you quickly summarize or briefly summarize what we talked about?
Thank you, Mr. Chair. As you already expressed, at least the first time in my time as a member of the Board of Health, we had a Board of Health and School Committee actual subcommittee meeting with School Committee member Martha Simon and School Committee member Carl Foss, and as Dr. Weiner said, he and I as well. The genesis of this meeting was initially to have a formal avenue of discussion regarding disparity in our town, but it is also a excellent opportunity to discuss issues or concerns regarding COVID-19 among the four of us, despite the efforts of the chair, the director, and the Board of Health staff every day to do so. We had some focal discussions around understanding the terms quarantine and understanding testing. And I believe that Mr. Foss and Ms. Simon left the school committee meeting with a much clearer understanding of those issues, enough so to have confidence in explaining those issues to their school committee and to other members as well. We also began a discussion regarding disparity, focusing on racial disparity in our town. And obviously there was no goal at that meeting of solving these issues. These are ongoing discussion, but I think we started off in a very good framework, defining the problem, which in our town, as in I'm sure many other towns, goes far beyond racial disparity. There are many other disparities that we need to address as well, but we thought that that addressing racial disparity was the best way to start and could possibly help us in understanding the others as well. So this was a precedent for me. We have decided to gather on a quarterly basis, but reserve the right to meet more frequently if the need should arise. And I think we concluded that just to mark the coming together of our two committees, Martha Salmon and I were going to put together a just a small blurb, perhaps for the patch, or at least to be presented maybe on BCAT News regarding our committees coming together.
Thank you very much. Are there any questions for Dr. Saltzman? If not, I'm going to please ask for a motion to approve the chairman's report and subcommittee report. We can approve them together. Do I have a motion, please?
So moved.
By Mary Beth Welch. Do I have a
Second.
second? I have a motion. I have a second by David McSweeney. Any other comments or discussion? If not, I'll put it to a vote. David McSweeney,
Aye.
Wayne Saltzman,
Aye.
Wilby Wallengevich, and Mary Beth Welch, and I vote yes, 5-0. Thank you so
Aye.
much. I want to ask a procedural question. I think under discussion, we can take up another issue, but I don't think, Susan, that since we have not posted any new business, that we cannot do that. Is that correct?
I'm going to defer to Dawn and see if she knows the answer to that.
I'm not sure if it's not on the agenda. I don't know if you can.
Yes, I don't think we can, but we can talk about it, and that may lead to a vote, what I believe. So Dr. Saltzman, if you could just hold that, please. Okay, application.
Mr. Department Procedure, I think that I am, I think perhaps I'm calling it new business incorrectly. It is more of a, it is perhaps not new business. It does not, in my view, it does not require an agenda to be confirmed. This is just an expression of an extension of perhaps your comments and the others, which I think is very important to have at this time. And I would very much like for your permission to, if anything, to include it in discussion. And I would like to do so now.
Susan, I think that's appropriate. Do you agree?
It sounds like it may be related to subcommittee reports. Is that fair to say, or is it a totally different topic?
It's related to the discussion we've already had regarding COVID-19 today.
Oh, on the school reopening.
No, just COVID-19.
Okay, I think that we could.
I wish for some latitude from the chair. I think after.
It's not latitude from the chair, it's latitude from the Commonwealth of Massachusetts. And I really don't. I want to make sure that this should not have been an agenda item, Dr. Saltzman. I really think we should hold this until discussion. I really do, please. I want to be.
And that's fine. And that's fine. If we're going to go into discussion, I would like to do it sooner than later.
Okay. Right now we have an application for a minor engineering change, 56 Middlesex Turnpike. Who is going to be presenting this is Christine Mathis, please.
Hi, yes, good evening. We have Mr. James DeCoulis with us, joining us tonight. I see him on the meeting, and he can jump in after I give a quick summary and provide some more information. 56 Middlesex is currently occupied by a two-story building, office-style building with associated parking. They're looking to modify the parking lot install an underground infiltration system for stormwater infiltration and move some parking spaces. So I'll let Mr. DeCoulis add to the information and share the site plans if he would.
Great. Thank you, Christine. Good evening, Dr. Weiner and members of the board. My name is James DeCoulos. I'm an environmental engineer. And as Christine said, I'm going to share my screen with you right now. What I want to do is just show you the project and what is being proposed. Okay. All right. As Christine mentioned, this is at 56 Middlesex Turnpike. It's a two-story building only near the entrance of the Middlesex Turnpike, because it's predominantly a one-story building. There's only a small portion, like maybe 1,500 square feet, that's at the subgrade. Essentially, it's a one-story building, but you know, I have a Google Earth here just to give people a sense. Is everyone familiar with the site?
Everyone is probably familiar, but you're on a town program, so please
Yeah.
go through it. There are a lot of people who may be watching.
Yeah, my apologies, Doctor. So this is the site from Google Earth here. Route 95, 128, Route 3, Middlesex Turnpike. As I zoom in here to the site, we have Trader Joe's across the street. What you're seeing here, this is the entire site here. The building that I was describing with the lower portion here of about 1,500 square feet is accessible from in this lower parking lot here. And then predominantly the upper portion is the main use of the building. It's an entrance. It has a dedicated entrance and egress. You can see here it says enter only. There's a small parking lot here to serve the subgrade space. And then as you drive up onto the main area here, this is the front door right here. What happened a few years ago, the applicant filed a minor engineering change with the planning board and did not perform the work completely. There was a plan that was submitted to have the work be a little closer to the Middlesex Turnpike, and it involved encroaching into the riverfront area. There's a river that runs down into the town aquifer across the Middlesex Turnpike. The applicant decided to go further away from the riverfront area, and that's why we're back for another minor engineering change. The work wasn't completed. There were no stormwater controls implemented. So what we're doing here is what we're trying to do is prevent stormwater from running down these entrance and egress driveways onto the Middlesex Turnpike. So we'll be improving public safety significantly by doing that.
Thank you. Chris,
I'm sorry. I just wanted to, if you don't mind, Doctor, I just want to show you where the stormwater controls are being proposed.
please.
Here's the site plan here. We're proposing a trench drain here at the entrance driveway at the top, and a similar trench drain before the egress exit onto Middlesex Turnpike. We'll be collecting stormwater in catch basins, infiltrating into an underground stormwater system, and then overflowing into this general area here. The other stormwater improvement is that we're going to provide a rain garden for two handicap accessible spaces. Right now, there's only one handicap space, and its ADA compliance is a little questionable. We're going to provide two ADA compliant handicap spaces to this lower level with a rain garden. That's essentially the project. Thank you.
Christine, do you, Ms. Mathis, do you have any issues here?
I don't. It's a pretty straightforward project.
We have 7 conditions. I want to make sure that you have seen those 7 conditions.
Yes,
And are you okay with those 7 conditions?
yes.
Okay, I have no problem with this. I've looked at this very closely. Has anyone else like to make comment?
So I guess so Christine, when was the site plan first approved? You're on mute.
David, it was 2014. It was January
2014.
Yeah, January of 2014.
Great. And why would this be considered a minor engineering change versus a new subdivision? I mean, there's some things in there, and again, overall, I don't have necessarily a concern with it, but like the rain garden and the new infiltration system, I think maybe it should have been a larger conversation.
Yeah, it actually fell below the threshold of a 20,000 square feet for a major stormwater permit. So the work it falls under, there's a threshold between 10 and 20,000 square feet with the Conservation Commission's stormwater bylaw. So that's why we're probably in this minor engineering change.
In the rain garden, how deep does that go? Near the handicap accessible
Yeah,
spots?
that's only going to be 2 feet deep. It's not going to be very deep. It's going to be a shallow garden. Yeah, we specify here it's a 2-foot deep rain garden, and then it will overflow. It's a significant improvement as to what exists right now, which is nothing.
Okay. And how far is that from the actual parking spot?
As you can see here, it's right next to parking spaces 9 and 10.
I meant from the handicap spot.
From the handicap. It's actually downhill. You see that the invert in here is 165. It's about 4 feet below. It's about 4 feet below and about 15 feet away horizontally. So it's down and out from the handicap spaces.
Will there be a barrier around it?
No, we were just going to landscape around it because of its shallow depth.
I guess what Ms. McSweeney is worried about is someone getting out in a wheelchair and in the downward ramp running into the rain garden. You
Yeah.
know,
No, we understood, and that's why we've proposed a curb around here.
there will be a
and-
curb around it?
Yes.
Okay. And last, who has designed the rain garden? We have not really had a rain garden in town that has really worked properly ever.
Yeah, I did one at for Darden Restaurants at the not the
Eddie V's?
not ADVs, the
Oh,
other
no.
project that Darden did. Right next to Barnes and Noble. I'm sorry.
The yard.
Yard House.
Yard House. Thank you.
Yeah.
The rain garden at the Yard House, Doctor, is actually pretty effective. I think if I've been there during some significant storms, and I think if you look at the front of that, you'll see that it's performed quite well.
If this was in a real residential area, we would have a lot of concerns, but it's not. And since you're curbing it, I think that's important, that we don't have a wheelchair or somebody going right into it. If anybody else, I'm okay with it there. It's small. It's not in a residential area. Um, can you point to it on the picture right now?
Yeah, it's right in this area here. As a matter of fact, the situation right now is very dangerous because this is a very steeply, whoops, zoomed in too far. This is a very steeply sloped grade right here. And the biggest fear right now is that the slope is so steep that you can't control yourself if you're getting into a wheelchair. It's a very dangerous situation because of the steep slope. So we're significantly reducing that slope, providing curbing, and the rain garden will be in this area right here.
And where's the front door though? Where's the front egress? So if somebody's parking there in the handicap, they have to go down and around the rain garden?
No. Let me bring up that plan again. There's a walkway that's actually proposed. What you do is you get into this handicap space here, and this is the handicap sidewalk here. And then the door for the lower level is right here.
Gotcha.
Can everyone see that okay?
Yeah.
Yes.
And again, Christine, you don't have any problems with this at all, do you?
I do not.
Okay. Would anyone else like to ask a question, or would someone like to make a motion which would include the 7 proposed conditions?
I'll make a motion to approve the application for minor engineering change, 56 Middlesex Turnpike, with the 7 proposed conditions.
Second,
I have a second. Any other discussion? If not, I'll put it to a vote. David McSweeney,
Aye.
Dr. Salzman,
Aye.
Libby Wallenjevich,
aye.
Mary Beth Welch,
Aye.
and I vote aye, 5-0. Thank you very much for coming before us this evening.
Great, thank you, and thank you for all the work that you're doing.
Thank you very much, and we appreciate it. Okay, which now we have to do a drive-through EDS planning discussion, and then we can go into any other discussion from there. Susan, do you want to bring that up?
Sure. So I'm just going to go through quickly what our EDS plan looks like. So I'm going to bring up 2 maps. So this is the map of the high school. So this shows our plan for coming in. The orange arrows show us the area where people will be directed in. They're going to go to area 1, which will be where they copy their, which is the registration area, and they would get their insurance information copied. Then they would move on to area 2, which is the medical screening area. Then it's down to area 3, where we're going to now have 2 lanes for dispensing. So we've already established the number of volunteers, and we're going to have 16 dispensers. So there'll be 8 dispensers on each line. We're going to rent 20 by 20 tents. So the cars will be able to drive underneath the tents, get their vaccinations, and then they would leave this area, drive around to the high school, and then they would be in area 4 where they would then stop and wait for 5 minutes, and then we would make sure there's no adverse reactions. If there is an adverse reaction occurring, they would pull into the parking lot here. And this is where we're going to have our EMT ambulance stationed. And then from here, then they would exit and leave the high school area. So I do have another map. Going to see if I could share that. A moment. Well, the second map, which I can't seem to bring up here, shows the traffic pattern. We're going to have police stationed along the way. We did meet with the police department, and they made recommendations as to where we would have the police stationed. They're also recommending, because this is an EDS site, that we have an overflow parking in our plan. So we're going to be using the teachers' parking lot, or the student parking lot, as a potential for queuing up cars if we ever needed to. So if we had too many cars and we need to get them off of Cambridge Street, the police would snake them inside of that student parking lot, and then that release them out to the traffic flow pattern that I just showed you. So
Susan, how many police will we need? Are they recommending? And will we have to pay out of our own budget for all those police officers?
So the town administration said that they would work with us on paying for the police budget, well, the police costs, but I'm also looking into the possibility of getting assistance from Leahy Health, which did reach out to me regarding whether they could provide us with any assistance. So I will more information on that to follow whether or not Leahy Health can help us out with that cost. But
Good.
the town administration did say that they would help out with that. So the total police that we need, because we're planning for if we had to give out COVID vaccine, is 8 police officers, traffic officers, and 1 site safety officer. So, yeah. Um,
And
and
if
then
we
we're
don't
also-
have, can we afford that without assistance? Probably not. Okay, I'm sorry.
Probably not. Yeah. And also we're working with other town departments. So we're working with the DPW, who is going to send people to help us out on that day. The Parks and Recreation Department said they have tents that we can use. They also can send people if we need them. We're working with the schools who have tents available that are hopefully going to set them up in their different areas around the high school. So it's a all department effort, and I think that's great because if we did have to give COVID-19 vaccine out, then that's what it would be. It would have to be all town departments working together. So I want to thank Samantha because she did a lot of work on the plan. I included the EDS drive-through plan in your Board of Health materials. So you can take a look at that. If you have any questions about it, just let me know. That was a template that was provided to us by Region 4AB Emergency Planner for drive-through flu vaccination or EDS planning. And it's the model that at least the Region 4AB is going to be using.
When is the date? You didn't give us the date and times.
So October 17th is the day that we're planning for. We're going to plan to start the vaccine at 10, so 10 to 1. We already sent out messages to the volunteers, so we have volunteers responded so quickly. We have, I think I estimated about over 50 volunteers who are going to be helping us out on that day with things like traffic and registration and medical screening. We still have some more planning that we need to do, and we'll be working on that with staff this week. And we have a schedule, and we're going to work through it. And that's it. If you have any questions.
This will be fully baked by our next meeting, so we can talk about it for the final plans.
Yeah. Well, the EDS plan that you have in front of you is the final plan. The only thing that we have to add to that is signage. So we have to work on the signage as far as where we're going to put signs. We have a load and go plan. We have all our regular EDS planning pretty much complete.
Thank you very much. Any other questions for Susan? Thank you, Susan. Are there any other discussion topics that someone would like to bring up tonight? Dr. Saltzman?
Thank you. I just wanted to offer that we have discussed COVID-19 in a variety of different ways today, but I wanted to ask the board to take a moment to recognize a very sad milestone that happened to occur today due to this pandemic in our country, and that is the unfortunate loss of over 200,000 people. And while we are very fortunate in our community to be healthy and intact, through a large part through good citizenship and the support of the board and our municipality, I would like to ask that we take a moment to recognize the lives lost during this pandemic. Thank you, Mr. Chair.
Thank you, Dr. Saltzman. Dr. Saltzman, we couldn't have done what we do without your medical and scientific expertise. Early on, you did multiple videos training both this group and the community. And I think this is a good time for us to call out your commitment and your dedication, not only to this board, but also to the town of Burlington. And we are privileged and we are blessed. Thank you so much, Dr. Salzman.
Thank you, Mr. Chair.
Here, here.
Staff reports, environmental engineer. Christine Mathis, our environmental engineer, please, can you give us a brief report?
Sure can. Thank you, Mr. Chair. I'd like to just give you a quick update. You had mentioned that we held household hazardous waste on September 12th. It was a little bit different look this year because we had precautions for COVID-19 and we required participants to wear masks, and both those coming to the event and those working the event, and to keep the participants to keep their windows rolled up, sort of a contact-free event, if you will. It went smoothly for the most part. We had just about 400 cars, and it was a very steady flow for the entire event. I'd like to thank the director and Dr. Weiner and the MRC volunteers and the DPW crew that worked the event, and really appreciate all their help.
Thank you.
And I had an update on the stormwater system, if you will, at 101 Middlesex Turnpike. That's the Vinebrook Plaza. I've spoken with their attorney on several occasions, and I've gotten water elevations from the DPW engineering department and passed those along to the attorney. They are out there this week looking at the catch basin that's in ruin, if you will, and looking at a potential blockage between the detention basins and the outflow point into Vine Brook. They're going to provide me regular updates on what they find from their inspections this week and a proposed plan to move forward at that site.
Thank you for Christine for following up on that.
Yep, sure.
Are there any other questions for Christine Mathis? I just have one, if no one else has any. We have a proposed subdivision, Redmond Street. Is that going to be coming before us anytime soon? I thought we were well ahead of the with that. Now I haven't seen it come up in a couple of months.
Yeah, they had it is scheduled to be on our next board meeting, which I believe is October 13th. However, at the request of the Conservation Committee, they had to go back and reflag the area, and they're looking at an entirely different access point, coming not in from Redmond, but coming in from another street on the other end of the site. And it would potentially eliminate that infiltration system that was going to be shared. I know that was one of the concerns when we had a subcommittee on it, but to my knowledge, they finished. I haven't been updated as to whether they finished flagging the wetlands yet. So that's the main delay in that project.
Thank you.
Sure.
If no other questions, I'll ask for a motion to approve the environmental engineer's report.
So moved.
I
Second.
have a motion, second by Mr. McSweeney, motion by Dr. Salzman. All in favor? David McSweeney,
Aye.
Dr. Salzman,
Aye.
Libby Wallen-Jevitz,
Aye.
Mary Beth Welch,
Aye.
and I vote aye, 5-0. Director of Public Health, Susan.
Yes, thank you. So since our last meeting, we've been doing a lot of flu clinic planning. Like I already mentioned, the planning around the October 17th EDS drill. We're also planning several smaller type clinics here for town employees, volunteers, and for the high dose vaccine. So our planning here involves a drive up. We know what type of vehicle you are. You wait into your vehicle until your appointment comes up. Then you walk in, get your vaccine, and walk out. So that's what we're planning now. That is for town employees, emergency responders, and Burlington Volunteer Reserve Corps volunteers, and then also the high dose vaccine. So, and then we've been working real closely with the schools and nothing new or different on the COVID work, just continuing with that. I'll take any questions if you have them.
Does anyone have any questions for our director?
Just one, Mr. Chairman. So Susan, since the governor rolled out the travel restriction stuff, how is that going? Are you getting? I'm assuming not a lot of people are traveling anyways, but are you getting a lot of those people that are in monitoring it? You're keying it into the database.
Yeah, so we have the ability to view those people that complete the travel form, but that data is a bit sparse. We're not getting all of the information. Sometimes we don't get, sometimes the addresses are incorrect as far as to where they're quarantining or whether they're going to get tested or not. It's really just a way for us to look at it. We're not doing any type of enforcement around that unless we get a complaint. So we haven't gotten any complaints other than the one that we had, over a month ago,
Right.
I think. So we haven't got any new complaints on that. But we do have the ability to monitor it and respond to complaints if they come in.
On that line, would you please, I addressed the Department of Public Health on a statewide teleconference what was it, Friday? And I was told that this is the way it is. It is a loophole. However, if we find it to be a continuous problem, we can ask the selectmen to move forward and change the town law. Is that about how to summarize it? And we would have to write something up and it would have to be approved by the selectmen. I think at this time, our director does not feel we need to go forward on that with the selectmen at this time.
Yes, that's correct. Also, too, what was stated was the people are, if you're traveling commute, so if you're saying you're commuting from another state for work, you're supposed to only be going to work. So you're supposed to be going to work, going to your hotel, going to work, then going back to your hotel. You're not supposed to be going out and visiting, restaurants or other places. So what they said on that call, it is a partial quarantine, I suppose, where you're quarantining, but you're still going to work.
We have reports from Marlene Johnson, our health agent. We have reports from Christine Pollock, our supervisory nurse, and we have reports from Samantha Hardy, our associate health inspector. I know you've all reviewed them, and since they are not going to be with us on these remote calls, if you have any questions around them, they're pretty straightforward. We can ask those questions through the director this evening if anybody has anything that they would like to ask concerning those.
Mr. Chair, can I just extend the comments of yourself and Susan with regard to our town and good citizenship? Was that a yes?
Yes, please.
Okay. Thank you. So there has been much discussion about whether or not masks are good or not good, useful or not useful. And I'm sorry for the additional noise, folks. There have been discussions as to whether social distancing is appropriate or not appropriate, to many of our dismay. The Board of Health does support mask usage, as well as social distancing and standard precautions, including hand washing, protecting others when you're ill, and maintaining hygiene with regard to surfaces as well. So there's no argument from this Board of Health with regard to the utility of those issues during during this time. I just wanted to make that statement as the news has been very confusing, I think, of late for our public.
Thank you very much. That's very helpful. Does anybody have any other questions with any of the reports that you have in hand? If not, I'll put it to a vote. Do I have a motion to accept the Director of Public Health's,
So moved.
Second.
Dr. Saltzman? Do I have a second?
Second.
Put it to a vote. David McSweeney,
Aye.
Wayne Saltzman,
Aye.
Libby Wallenjevich,
Aye.
Mary Beth Welch.
Aye.
I vote aye. Don Cathcart, did we vote on the environmental engineers report?
Yes, you did.
Thank you very much. Getting old. Anyway, if there's anything else, that's the end of our agenda. Does anyone else like to make any comments at this time? Thank you very much. I just want to wish our Jewish community Happy New Year. We're in the midst of their days of awe. And with that, I want to thank everybody for tuning in. Dr. Saltzman, your final comment as always?
We're entering into into what could be a tough time, although I hope not, given the reports of low flu yields in the Southern Hemisphere. Regardless, please, everyone, continue your efforts to be good citizens and support each other. And that always includes hand washing, hand washing, hand washing.
Thank you very much. Before we adjourn, I want to thank everybody for being here this evening. I really appreciate it, both staff and the board. It's very nice to have a full board tonight. Do I have a motion to adjourn?
So moved.
Ms.
Second.
McSweeney, do I second?
Second.
Libby Wallenjevich. David McSweeney.
Aye.
Wayne Saltzman.
Aye.
Libby Wallenjevich.
Aye.
Mary Beth Welch.
Aye.
And I vote aye, 5-0. Thank you again. Good night, everybody.
Good night.
Good night.
Good night. Thanks, Ed.